Hello, my name is Instructor Shane. Today we're going to be talking about a very specific part of the patient assessment called our sample. A sample is actually an acronym that we use to help guide us through our patient assessment of our both our medical and trauma patients. As you can see on the board here, sample actually stands for, S stands for signs and symptoms, A stands for allergies, M stands for medications, P stands for pertinent past medical history, L stands for last intake and output, or last oral intake. E stands for events leading to the actual problem. And I'm going to go ahead and break these down for us a little bit so we can try to understand it a little bit better. So the signs and symptoms are what the patient complains of, right? The signs is what they are showing, and the symptoms is going to be their actual complaint. Like, do they have any shortness of breath? Do they have any chest pain? Symptoms are going to be that they're going to be pale or diaphoretic, or that they are actually going to be cool and clammy. And these are the things that we're going to ask them. We're going to say, what made you call 911 today? And in the case of somebody having, say, trouble breathing, they might say, man, I've been having trouble breathing now for 2 days. And that would be part of their chief complaint. And that will go into that sign and symptom. Allergies can be anything. It can be allergies to both medications and environmental. So we want to get a good sense of what their allergies are too. And when we ask our patient this, it's going to be simple. Ma'am, do you have any allergies to medications that you know of? Or do you have any allergies to environment that you know of? Any allergies to bees or pollen, things of that nature? We want to know that, especially if it's pertinent to what the patient called 911 for. Medications are going to be all the medications that they take. You'll find in the pre-hospital environment that many of our patients have a large list of medications. Perhaps some of them have a huge bag of medications, and it is part of our job to write down these medications, to include the dosages, so that way the hospital, if we take them to the hospital, the physician at the hospital will be able to adequately treat our patients. A lot of times with medications, some of the problems that we see in the pre-hospital environment will be because patients are taking multiple medications, and we need to be able to ascertain that by determining what kind of medications that they are on. Pertinent past medical history. So what that means is we want to know what kind of medical history they have that is actually important for while we're there. So if they've got a history of bunions and they're calling 911 for chest pain, I don't necessarily need to know that they have a history of the bunions, right? But if they do have a history of diabetes or chest pain or cardiac problems or high blood pressure or breathing problems or something along those lines, that is a pertinent past medical history that we need to know about. When I ask my patients about their history, I will often be very specific on the history that I'm asking for. I might say, do you have any history of heart problems? Do you have any history of breathing problems like COPD or asthma or congestive heart failure? Or I might be more specific and say, do you have any diabetes? Like, do you take a pill or do you take insulin? I'm very specific about those medical history because it helps me to be able to paint that picture for the physician when we get to the hospital. Last oral intake, or last ins and out, that is a pretty important subject. We want to know when the patient last was able to eat something, when they were able to drink, when they were able to take their meds, and have they been taking their meds, and also when were they able to move their bowels and able to urinate. These are all very important things for the last oral intake. Don't just get so hyper focused on last oral intake. When was the last time you ate something? There needs to be more to this. It's a very important subject. And then the events leading to it. Basically, what were you doing when this started? Okay, well, I was playing Wii bowling right before I started having chest pain. That's what happened. That was the events leading up to it. Okay? All right, well, that concludes our patient assessment for the sample. Thank you.